about it, you're actually being proactive. You guys are the doers, and I really congratulate you for coming out and learning as much as you can about cystic fibrosis. A little bit about myself. I trained for medical school and residency. Residency is the general pediatric part in Albuquerque, New Mexico. And then after that, I went to do fellowship training in pediatric pulmonology in Arkansas, in Little Rock. After that, my first job was in Texas, and so I'm moving from Texas to here. I have 2 children and a husband, and we all are loving Spokane. But I hear that the winters are not usually this nice, so I'm just enjoying it while we can. My topic is I think it's mostly an introduction to the Cystic Fibrosis Foundation Infection Prevention and Control Guidelines. That's a really big name. They call it IP&C Guidelines for short. So you'll see that through the slides. IP&C means Infection Prevention and Control Guidelines. So the reason I say that this is more of an introduction is because it's about a 60-some-odd page document, and I want to review it in about 20 minutes, and then have time for discussion and questions afterwards. So let me get started. I have the same question Dr. McCarthy did. So, I could probably do that. Okay. All right. So why do we even need these guidelines? The Cystic Fibrosis Foundation works in a lot of different areas, as you can tell, from advocacy to research. And why are they meddling with infection prevention and control? The reason is because people with cystic fibrosis, what is life-limiting for them is the infections, or one of the things that is life-limiting other than nutrition is that infections in their lungs can lead to very rapid lung function decline. And that's why the life expectancy for people with cystic fibrosis is limited. It's because of these infections. And so by trying to do the best that we can at controlling what germs are growing in the airways and lungs of a person with cystic fibrosis, we can make an impact in that particular person's lifespan. Dr. McCarthy did a really nice job of talking about the thick mucus and the chronic infection leading to damage. So the Cystic Fibrosis Foundation is trying to find the best way to reduce the spread of germs. This is a graph that is very well known to people who provide care for people with cystic fibrosis, but I don't know if it's well known to parents of kids with CF or to other caregivers. It's a graph that shows what bugs are growing in the lungs on average at different age times. So on the y-axis, you can see the percent of patients. On the x-axis, you see the age groups here. Let me see if I can find those. I'll just use this. So here we go. So you see this is children aged less than 2 to 5, and so on and so forth. And at the beginning, you see this kind of greenish line. That's Staph aureus. It's a very, very common bacteria in very young children. But as a person with cystic fibrosis gets older, that tends to decrease. And then the blue line, which is the Pseudomonas, tends to increase. Well, the problem with this increase is that Pseudomonas is a very well-known bug to cause damage in the airways, leading to that bronchiectasis that Dr. McCarthy talked about. So these infection prevention and control guidelines are meant to try to slow this process or even prevent a person from getting an infection or getting colonized with a bacteria that would damage their lungs. The IP&C guidelines were put together back in 2009. very first time that they did it. Do you know if that was it? Anyway, the last revision of the guidelines were back in 2003. Lots of research, lots of new information about how bugs divide and what kills bugs and all of that stuff happened in the last 10 years. So in 2014, they thought, it's time for us to update these guidelines. So they got a panel of experts in the field of cystic fibrosis. There were also 3 parents of children with cystic fibrosis, and there was an adult with cystic fibrosis. And they step-by-step reviewed the old guidelines and did a lot of research to try to bring them up to date with new information. And in addition, I remember all of the cystic fibrosis centers across the United States got the rough draft of these guidelines back last summer. Excuse me. And everybody got a chance to review them, put in their 2 cents, and the expert panel reconvened, and this was an ongoing process. And finally, in the fall of 2014, these guidelines were finally published, and that's what we're going to review today. So they divided up the guidelines into 7 areas that you can see here. We're only going to talk about the orange ones because I had to make this presentation as short as I could. But the core recommendations are the longest section that you'll see here, and we'll go step by step and review them. And then we're going to talk about the cystic fibrosis clinic and what recommendations are made for that kind of setting, and then for hospitals or the inpatient setting. And then the non-healthcare setting. And finally, just one slide regarding the psychosocial and medical impact of these guidelines. So let's start off with the core recommendations. We're just going to dive right into them. The number one guideline that they, not necessarily because it's the most important, although arguably it could be the most important, is that education of healthcare personnel, people with cystic fibrosis and families, should be not a passive effort, but a very planned out effort. So trying to disseminate this information to everybody involved with somebody with cystic fibrosis is very, very important, and they made that a guideline. And then also, and this is more important for the cystic fibrosis care team members, is to try to talk to the hospital or organization that you work for and see what kind of guidelines exist there already, and if modifications need to be made, to work with them to make those modifications. And I know that Kendra here has done a lot of work in talking with the Providence infection prevention and control team here. And just a little short thing for healthcare personnel. So if you see us breaking the guidelines, please bring it to our attention. And that involves, not only the physicians, but the nurses and such. But make sure that the person taking care of the patient with cystic fibrosis is washing their hands before they come in the room, when they leave the room, before they put their gloves on, no artificial nails or extenders, and then disinfect stethoscopes. And that's one that I think we could work on. After these guidelines, I started alcoholing my stethoscope between every patient, not just patients with CF, and I destroyed my stethoscope. So I'll have to think of a better way. The alcohol ate the rubber around it. But disinfecting stethoscopes is a very important thing. And you've probably noticed that we always wear gowns and gloves before going into the room of a patient with cystic fibrosis. This is per these recommendations, and doing it in every setting, whether it's pulmonary clinic, whether it's the GI clinic, ENT clinic, in the hospital. The person taking care of somebody with CF should wear a gown and gloves. Mask is not as routine. Mask is only for those folks who have known infections that can be passed on to another by droplets. So things like influenza and some of the other viruses. There's a bacteria called mycoplasma. That one also requires a mask, but for the most part, we don't use masks. However, we're going to get into it a little bit later that patients with cystic fibrosis should wear masks. And then there's this thing called the negative airflow room. This is a room that is constantly moving air to the outside, and the air is not staying in the room. And those we say for people who have known tuberculosis, which is just because you have CF doesn't mean you can't get tuberculosis. So we check that at least on an annual basis. So now we're going to move away from people who are caring for folks with CF and now to people who have CF. All people with cystic fibrosis should be separated by at least 6 feet from others from other person with cystic fibrosis in all settings. This means at school, this means at clinic, anywhere, even during the Great Strides walks. At least 6 feet. It used to be 3 feet. Does anybody remember the 3-foot rule? Now it's doubled. It's 6 feet. And the reason that they moved it to 6 feet is because of studies that came out in the last 10 years of how far our saliva travels when we cough. And 6 feet is a much safer distance. It's 2 yardsticks away. And that hand washing that the caregivers are supposed to do, patients and their families should be doing that too. When you come into the room, wash your hands. When you're leaving the room, wash your hands. We try to leave or to have sanitizers or the sink, and it's okay to use the sink in the exam rooms to wash your hands. And then also at any point during the clinic visit or other times you cough, your hands get contaminated, again, time to wash your hands. Learning to cough into not hands but into a Kleenex or into your shoulder, kind of in that direction, is also important to start teaching the little ones to not cough like this, but to cough like this. And then folks who have cystic fibrosis, as an extra precaution, anytime that they're going to be walking through a healthcare facility, either clinic or hospital, should be wearing a mask. And I know that Kendra has been doing some work in providing masks in the exam rooms of patient waiting areas in the clinics for GI and for pulmonary. Are you doing that for EMT also, Kendra? Or no, not yet. But it's a work in progress. So we're working on it. And it's okay to grab a couple of extra masks. For the next time that you come into clinic, you already have the mask available. So people who have cystic fibrosis and they're going to be around another person who has cystic fibrosis that doesn't live in their house, there's also recommendations regarding that. Trying to avoid physical contact. No handshakes, no riding in the same car, no sharing hotel rooms, try not to be in the same fitness class. So, we have this 6-foot rule, but if you know that another person has cystic fibrosis, then actually trying to not put yourself in a situation where you have to be thinking about that 6-foot rule. If 2 people do live in the same household and they have cystic fibrosis, try not to share personal items like cups, toothbrushes, those kinds of things. And we'll get into the nebulizer equipment, but try not to share that either. A big question that comes up is that this Pseudomonas that we were talking about earlier, it likes to live in warm, moist, dark areas. And so it loves to live in our kitchen sinks, in the shower heads. It likes to live in outdoor water. And one thing that I learned is that fake snow has a lot of Pseudomonas in it too. It's everywhere. You can't avoid it. So knowing that the Pseudomonas is so ubiquitous in our environment, how are we going to avoid it? There are a few things that the CF Foundation recommends regarding water sources. It's okay to use tap or well water, that means the local public health standards, for things like drinking, bathing, cleaning respiratory equipment, and for the heat disinfection of the respiratory equipment. But if you're going to put the water directly into your nose, like for the neti pot rinses. I don't know if any of the folks here have people with CF who use the nasal rinses. Always use sterile water for that because of that Pseudomonas issue. Also, if you have humidifiers at home, make sure that that is sterile water. And for those that disinfect with the cold method that we're going to talk about later with alcohol or hydrogen peroxide, afterwards you should disinfect with sterile water. Another big recommendation for both healthcare workers and for folks who have cystic fibrosis and their families is to stay up to date with immunizations, which includes the yearly influenza shot. The influenza shots save lives, and I think if you ask anybody who works in healthcare, they'll agree to that. But there's a lot of misinformation in the general population about whether the flu shots work or not. But even this year, even though they missed the mark, they still saved some people from getting the flu, and having complications from it. So staying up to date with the pneumonia shot, the flu shot, and all the childhood immunizations. Okay, so now we're going to switch gears. We finished off the core recommendations. We're going to switch to cystic fibrosis clinics. So one of the big things that a lot of clinics across the United States concentrated on after these guidelines is to minimize time in common waiting areas, which means as soon as the child or patient with cystic fibrosis comes into the clinic, put them in a room, not having them wait in the waiting area. And we've been, here trying to work in that. Sometimes we're limited by the number of exam rooms that are available. But the next slide, I'm going to talk about something called a Fast Pass, which is pretty exciting. And again, it's another one of Kendra's many projects that she's working on. The other thing that we've been thinking a lot about is whenever a person is doing the blowing test or the spirometry, they're blowing, and those germs can be spreading into the environment in that room. So they did some very interesting studies in putting filters in the air conditioning or heating ducts and seeing if the germs of that patient were found in those filters. And what they found is that yes, they are. And so I forgot the location. I don't know if either Dr. I or Dr. McCarthy remembers where all of these studies were done. I think in Ohio. But anyway, they changed out the filters every 5 minutes to see when those germs kind of went away, and it was after 30 minutes. So the guidelines right now state that if a spirometry or that blowing test is done in a room before the next patient with cystic fibrosis comes in, that room should be left by itself for 30 minutes to kind of let the air settle. Either that, or you could use HEPA filters, and that's the plan here, is to use HEPA filters, but it's kind of an involved process to try to get one of those. So that's in the process. Hopefully in the next couple of years we'll have that. For now we're doing the 30-minute rule. But that's, things that are on the clinic side. Now the exciting part. This is I don't know if this is the first time folks are seeing the Fast Pass. It's a very nice program that Kendra is trying to implement, that a patient with cystic fibrosis could carry with them when they arrive in clinic. They give this to the person checking them in, and then that person is alerted. This patient should not be in the waiting room for very long, and then the provider should wear the gown and gloves for them. And it's kind of like going to this Disney World and getting that Fast Pass. It's kind of a fun thing. Since you have to come so often to the hospital, we need to make things happen so that you're not exposed to so many germs. So now moving away from the clinic into the hospital setting. I'll just go through these really fast. It's recommended to have single patient rooms. As far as that patient walking out to say, the play area or walking to the cafeteria. That's going to go patient by patient on a case-by-case basis. Performing the airway clearance in the patient's room, not in another location. I think that's, a no-brainer that should be happening. Airway clearance devices should be single patient use only. And then following the institution's rules for having guests regarding the mask, gown, and gloves. I don't know what happens right now when families come and visit a patient in the hospital. Does the family have to wear a gown and glove? Or no? Yeah. Because if the family is going to come straight to the room and then go straight home, it should be okay. The reason for gown and gloves for the healthcare providers is because we're seeing one patient and then another and then another and then another. So we don't want to pass germs from one patient to another. And then the hospital nebulizer should be single patient use only. They should be cleaning them as good or better than you do at home. Using whenever you're putting the medicine, it should be used with aseptic technique. And then using single-dose vials. Sometimes that albuterol especially would come in multi-dose vials, but I think most of our medicines are single-dose vials now. So that's the hospital side. The non-healthcare setting, this means out in the world. If more than one person with cystic fibrosis is in the home, airway clearance should be performed at different times in the same room or in two different rooms. But doing them together at the same time, that was one of the new recommendations for this. And having this in mind, it was interesting to see the video of advocacy with the two sisters on the same couch. I think that from now on, it's not going to be recommended to do that anymore. Again, because you're aerosolizing some of those germs with coughing during vest treatments and so forth. So as far as attending social events such as camp, it's okay for children with cystic fibrosis to attend summer camp as long as they're the only person with cystic fibrosis that's attending that camp. So even though kids with CF can't get together anymore and attend camp together because of this germ issue, it's strongly recommended that they still participate in those things as long as they're the only child with cystic fibrosis. Where I came from, we had an asthma camp, and we would invite one child with CF every year. So, and you can look for those kinds of opportunities. And there's a whole lot more to attending school or daycare, but kind of the bottom line is, if two children with cystic fibrosis are attending the same school, it probably would be better for the school to know that those children have cystic fibrosis so that then these rules could make sense. It's up to each person or to each family to decide whether the school or the employment knows about the cystic fibrosis, but sometimes it's better that they do know because then you can make these infection prevention and control principles make sense to the folks at school. We ran into this because I lived in a small community and there were 3 kids in middle school that attended the same school that all had CF, and we just had to make sure that their choir practices were different. There were 2 kids in the same choir and they had to stand in 2 different sites of the choir. Those kinds of things, different lunches, different recesses, that kind of stuff. In a larger community like here, I don't know that that's a big problem. So CF-related events like the Great Strides Walk and all of the other nice events that we heard about before, these are the guidelines. So if it's going to happen indoors, kind of like summer camps, only one person with cystic fibrosis can attend per event unless they live in the same household. And if it's going to happen outdoors, multiple people with cystic fibrosis can attend as long as they follow that 6-foot rule. And I think especially in the Great Strides Walks, the kids just love to mingle. But I think parents should remember the 6-foot rule and kind of keep each team separate, so that we don't put the children at higher risk. All right, so moving on to nebulizers at home. And this should be reviewed for you guys, I hope. So after each use, a nebulizer should be cleaned with dish soap and water, and then it should also be disinfected. So it's nice to have multiple sets of nebulizers so that you don't have to, rush and do this one so that for the next breathing treatment, maybe you could have 1 day's worth of nebulizers. But the disinfecting methods, if you're going to use heat, you either boil or microwave in water for 5 minutes. You could use the dishwasher or you could use an electric steam sterilizer. For the cold disinfection, you soak it in either alcohol or hydrogen peroxide, but notice the time difference. For alcohol, it's 5 minutes. For hydrogen peroxide, 30 minutes. And then you rinse it off with the sterile water we were talking about earlier. Okay, and then just explore about leisure activities, because you know how I was telling you that this Pseudomonas lives out in the environment? Well, there's some other very harmful bacteria that live in soil. One of them is Burkholderia cepacia, and that one actually causes lung decline even faster than Pseudomonas, so we are a lot more careful with this Burkholderia. And Aspergillus can cause something called allergic bronchopulmonary aspergillosis that people with CF and with asthma are more prone to get. So the guidelines state that people with cystic fibrosis should limit prolonged or repeated exposure to dust from soil and organic matter, and they should avoid exposure to construction and renovation activities. So what does that mean? It means things like plowing the fields, probably not a good activity for somebody with cystic fibrosis. Gardening should be more limited, rather than spending a lot of time, working with the soil. And in fact, if it can be avoided, that would be better. I think it's better to harvest than to plant anyway, so let somebody else do the planting, you can just harvest. And then water for leisure, that's what we were talking about earlier. So making sure that pools and water parks are adequately disinfected, and it's okay to ask if you're going to go to a public pool, kind of what chlorination protocols they have. Usually they do a very good job, because you could imagine how much they could get sued if they didn't. My brother is an architect, and he says he doesn't like working on water projects because they have so many checks and balances. So, and then avoiding hot tubs, whirlpools, spas, and stagnant water. That's where a lot of bacteria like to grow. And from what I hear here in Washington, instead of having a lot of outdoor pools like they do in Texas, it's more of enclosed spas and enclosed hot tubs that people tend to have at home. It not only should you limit the child with CF getting into the water, but also being in that room that has so much humidity and so many little nooks and crevices that bacteria can start growing in. So not holding the baby in the room that has the spa or a hot tub in it. And then as far as going swimming out in lakes, as long as the water is not stagnant, it should be okay. So kind of being thoughtful about that and actually thinking of where you're going to take the family for a fun picnic. And then pets and farm animals. It's really important to wash hands. You're getting the theme of the hand washing here. After changing litter boxes, handling feces of any animal, cleaning cages or fish tanks, interacting with farm animals. What has been studied and has been found to cause infections in the lungs is cleaning stalls, pens, or coops. That's where you're going in, all this dust is being raised, all of this, old poop and such is aerosolizing. Those are very dangerous. And so people with cystic fibrosis should avoid those activities. So this is the one slide I was telling you about, the psychosocial impact of these guidelines, because it does make a difference because people with cystic fibrosis cannot interact with each other. So number one, to try to ease at school, trying to educate teachers, employers, and friends of the reason behind the guidelines, and not just saying, no, I can't get close to that person without explaining why, because I think most people will be much more prone to help others if they understand the why behind it. And then as a person with CF or the parents of somebody with, or caregiver of somebody with cystic fibrosis, talking to the team about what bacteria came back in the last culture. And if we don't mention it in clinic, you can ask about it. And being aware of the bacteria that are being tested. And then being creative with accommodations to relieve the stress of the guidelines, especially in the hospital. The walls of the hospital room get smaller and smaller every day whenever you're in here for 2 weeks. And so trying to relieve some of that boredom, that's something that Kendra and the social workers and the child life specialists are in the hospital all try to work with. And that's something also that the Family Advisory Board, if you guys hear or come up with ideas of things that could help us either implement the guidelines or help relieve some of the stress caused by the guidelines, those would be very good things to bring up. So the bottom line is, germs are here to stay. We're not going to get rid of them, although we would love to. But you can reduce the risk of getting or spreading them. And again, going back to the Cystic Fibrosis Foundation websites that has been shown earlier today, there's a link on there. If you go to Living with CF and then Infection Prevention and Control Guidelines, everything I said and much more is on there, and you can actually download the guidelines themselves also. If you have any questions, of course, we can talk about it in clinic. But, did this bring up any questions for you guys here? All right, and like I said, this is just an introduction to it. There's a whole lot more. But thank you for your attention.
Thank you so much. And I know the biggest change, especially for our preteen and teenagers, is the mask on campus. And so we'll try to, I'm trying to use some peer pressure. Everyone's doing it. I mean, don't be the only one out there without a mask. But one thing that I've seen, and this is coming from families, is on Amazon they have some kind of cool masks that have designs. They're cloth that can be washed. Whatever is workable for your family, for your child, or you, we want to encourage that. So we're not picky. We're pretty much just want cover your nose and your mouth. And we're also really trying to, for our older patients, have them to, we're a community, and even though we can't encourage each other to hang out, to realize, we have 170 some patients, and some of those are toddlers who will not keep a mask on. So, hey, 13-year-old, help keep the 2-year-old protected, and really kind of help them take some responsibility, knowing they're actually helping, the 2-year-old walking around. So it'll be a work in progress, and with the Fast Pass, the real purpose of that is not for our clinic cleaners who has CF. It's really for when you're going to peds endocrinology, who sees a lot of our patients, or GI, or inland imaging to get your x-ray, or the lab. That's really where that Fast Pass, and I apologize, we were hoping to have it here today and have all those departments educated. It's happening. We're not quite ready to roll it out. But we also would advocate, of course, be your own advocate. And I know there's a family in this room that already talked to their primary. And the primary reached out to us and said, should we be gowning and gloving? And we explained that if they don't see anyone else for CF that day, probably technically not. But you as a family can always, someone mentioned, made a comment like, well, you guys should have always required masks. Well, we were waiting for the research and guidelines, but we will never tell you to do less. So if you feel more comfortable with the whole family wear a mask, go for it. We'll never tell you less. But it's a work in progress, and we'll try to keep you up to date as new things are rolled out. So right now we have Dr. Pragya Rai, our other pulmonologist, coming up. And I'm really excited because she's bringing a topic that we really haven't been talking about, either in clinic or at events like this. So I'll get these queued up.
Hello, can you hear me? So when Dr. Chavez was introducing herself, I was kind of debating and thinking about whether I should also do deep introduction, a prolonged introduction of myself, because I've been here about 3 years and I see a lot of familiar faces here today, but I also see a lot of new faces. So just briefly, my name is Pragya Rai. I did my residency in New York, my pediatric residency, and then I did my pediatric pulmonary fellowship in Houston, and then I moved here to Spokane about 3 years ago. Originally, I'm from Nepal. A lot of patients like to ask me that, where I am from. So I think this is a good opportunity for me also to resonate the same thing that Dr. McCarthy and Dr. Chavez said, that we do applaud you a lot for the care that you do for your children on a day-to-day basis, and especially the children, because I do think it is a lot of things that you guys do on a daily basis. And so I'd like to talk about sleep now and kind of wind down the day. We've had a lot of interesting topics throughout the day, and we learned a lot from you guys as well as Dr. McCarthy and Dr. Chavez. So kind of going down to something more relaxing in a way. We'll discuss about sleep, and I've tried to choose the background suitable for it, hopefully. So I'd like to begin with this wonderful quotation by this wise man, Ralph Waldo Emerson, who says, "There was never a child so lovely, but his mother was glad to get him to sleep." And I think this resonates a lot with young mothers, and every mother and father, obviously. And so it seems that sleep is very important. Although we think that sleep is when you kind of rest, and this is the end of the day, you're kind of giving into sleep, and we're not really doing anything. But sleep is actually not a passive process. It is as active as wakefulness, because there are a lot of things that are done while we sleep. And the brain is not technically at rest, but a lot of important functions are being done by the brain. And so there have been many theories of sleep, some of them being restorative theory, adaptive theory, energy conservation theory, so many theories of sleep. I would like to talk a little bit about history, is always interesting to me. So the sleep was recognized as being important, not just as a passive process, but something more active. Way back in 1889, there's some old journals which go back up to 1889 by certain British doctors who mentioned that. And I don't know if anybody has read the Pickwick Papers. Anybody? Probably. Okay. So, nor have I. It was published in 1827 by Charles Dickens. And there is a character in this book called Fat Joe. And so Fat Joe was apparently a very fat person, and he was always falling asleep at the drop of a hat. And so now they've actually coined a term called obesity hypoventilation, and has been named the Pickwickian syndrome. So kind of sleep actually goes back many hundreds of years ago. And it was only in 1968 that Dr. Scale and I don't know how to pronounce his name, but Dr. Red Shefan kind of